Good evening to this evening's Health and Wellbeing Board. And before we go on to the agenda proper, I just have a little statement to read out to you. The meeting will be live streamed this evening to the public, and we welcome any of the public that are logged on with us this evening. A recording of the public part of the meeting will be available on the Council's website within 24 hours of the meeting. This is the first occasion remote participant officers will be joining the meeting, so we welcome them. We would remote participants please use their hands up icon in Teams to indicate they have a question. Please turn your camera on, microphones off when you are not speaking. In-person attendees are required to wear masks on entry to the building and meeting room, but may remove them once they are seated. Would members and officers please remember to switch their microphone on when speaking and off when they are finished speaking, and please speak directly into the microphone. Okay, that's my little speech before we start. Now we'll move on to the agenda proper and welcome you all here this evening. I think we all know each other, don't we? I don't need to do any introductions around the room. We all know each other, don't we? Good. Apologies for absence.
Yes, Chair, we get apologies from David Carter. David Hartthorne should be joining us to present a report on his behalf. We get apologies from Lucy Nicholson. Okay, thank you very much.
Minutes of the last meeting that are in your document. I'm not going to go through them. I'm assuming if you've got any issues, you'll raise them with me now. Is everyone okay for me to sign the minutes of the last meeting? Okay, thank you very much. Remind members of disclosures of interest on the agenda, and we have no urgent business. We've no references from committees and other bodies, so we'll move straight on to the reports section. And the first report is an update on COVID-19 in Luton, and that's, is that you, Sally?
Yes, thank you. So the paper is, as usual, in your packs, but I've got a verbal update with some slightly more up-to-date information. So our rates as of today are 393 cases per 100,000, and the rates have been relatively flat in recent days, weeks, but with a slow increase. We're currently below the England and East of England averages, and both of those are increasing. Our highest case rates currently, and have been for a number of weeks now, are in the 10 to 14-year-olds. So we have been seeing an increase in cases in school settings, and our 60+ numbers have also doubled in the last week, but from a relatively low baseline, but we are seeing an increase in that age group as well. We have a number of cases in schools, but we have 3 schools that have particularly large numbers of cases at the moment, and we're working with them to introduce additional control measures and work with the schools to manage the outbreaks. We continue to have low vaccination uptake rates compared to national, and we're doing lots of work with CCG partners to increase that and to ensure that the offer is clear and communicated to the community. There's lots of work in more recent weeks around strengthening the pharmacy offer and ensuring that the pharmacies are accessible and that people know that they can access pharmacy for vaccination. We are getting some new data on modelled prevalence estimates so that we can start to look at what a model from the national team says our prevalence should be versus what we are seeing locally. It's new data, so we haven't worked out exactly how to best use this and what it would trigger in terms of actions, but we're just starting to look at that, so I can keep you all updated on that. Last week or the week before, on the 7th of October, the new national contain framework was launched, which is, if you remember, which is the national documentation that locally we then develop our local outbreak management plans based on, so what we call the LOMP. So because the new contain framework has just been released, we will need to have a look at our LOMP again, but I think, a relatively light touch in terms of reviewing that. There's not a national deadline where we have to respond to this time, but I think it's probably a good time to refresh and review, check it's still in line with the national guidance, and perhaps do a bit of rationalisation around processes that we have in place now, and have a think about that. So I can bring that back next time. I think I'll stop there and open up for questions.
Questions?
The last time we were here, there was an issue with care homes. What's the update on that one?
We are still seeing cases in care homes, but it's been relatively stable. So there's a few cases, a few care homes that have a small number of cases. There's one that there's going to be an outbreak management group meeting just to review and check through any additional actions that need to be in place. But other than that, there is just sort of a background level of a certain number of cases. We've stepped up to have weekly meetings again, just to check through that all the information is going out to care homes in a timely fashion and that they know all of the actions that need to be in place. And we've got a very clear process for where they speak to when they have cases and who they report that to and the conversation that needs to be had with them. So I think in the last meeting, we were seeing that increase coming again, and it's just remained relatively flat since then.
Okay. Anybody else? Javid?
Thank you, Chair. Just on the care home settings, I take it we've seen a rise in COVID, but we haven't had any deaths reported. That was one question. What's the outcome? Hopefully there isn't any deaths. Secondly, what are we doing in terms of funding to help them maintain the outbreak management? And third, in the schools, is it a particular year group that's being affected, or is it across? I know you said 12 to 14. Is it a particular year group? And fourth and last question is staff, home care staff vaccination, because it was low, it became mandatory. What sort of negative or positive effect has that had?
Apologies. So in answer to the last question, we've seen quite a large increase in the vaccination rates in care home staff. So the rates are now well in the 90s in terms of overall uptake, which is great news. And there's a piece of work that's happening to review the stability of those care homes. So if staff are planning to leave the care sector because of wanting to be vaccinated or not being able to be vaccinated, if they're not able to, then they obviously don't need to, but for not wanting to be vaccinated, then we're reviewing what the impact of that might be on the market. In terms of the funding for the care sector, there has now been another quarter of the Infection Control Fund announced, so that's coming down to care homes now, which is good news. It was an incredibly last-minute announcement, so there's been a lot of work to try and manage that again for another quarter. And there will be some review happening around what that means for next year when that funding then does run out. In terms of the schools, the age range is the 10 to 14-year-olds that I mentioned, but I don't have the information in terms of year group. So the data is split by that age group. And then I think your last question was about deaths in care homes, wasn't it? I don't have any data about deaths in care homes, unfortunately.
Just one supplementary question on the outbreak funding. What checks are we doing to make sure the funding is used to contain funding? It's not being used to do other stuff in the care homes. What sort of checks are we doing?
There's some quite strict criteria for what they need to use that money for. And in order to release the funding, we ask them to report back on, we have to do a return to the national team as well about what it's been spent on. So the care homes have to respond with the filling in how much they've spent in which areas to the team to then release the funding for the next month. Yeah, there's a very clear audit trail.
Any other questions?
Thank you. What we're seeing in the health sector, both locally and nationally, is misuse of lateral flow tests in symptomatic people, so not using a PCR, and also members of the public being convinced that they've not got COVID and therefore don't test with anything. So it feels like there's a fatigue around symptoms and testing, and I wondered if there any initiative to sort of change, revitalise and change the messaging to try and land the messages again, because it does feel, as I say, as if the public think that's gone away, and yet it clearly hasn't. We can all see that, and so we're grateful for your thoughts on that. Thanks.
Thank you. Yes, I think that is a challenge, and I think I have anecdotally heard a lot about people using LFDs when symptomatic because they're at home in the drawer and they can access them easily. So I think probably it's a good action to take away and have a think about that. We are seeing quite good distribution of our LFDs, that they're available in the mall a lot more again now, and we've seen an increase in, that's the main site that people are taking them from now. But we have seen an increase in PCRs as well, in an increase of 21% in the last week, which is quite good. But I think that messaging has definitely, there is fatigue around that. Yeah, I would agree. So I think I'll take that away and speak to the communications team around what we can do about that. We've got a standard similar to the vaccination saying this is where you can go this week and this is the schedule. But I think what you should do when would be quite good to do a bit more of a push on. So yeah.
Just a couple more. One to follow up is AZ. Is AstraZeneca readily available now in Luton for the second dose? Because that was a shortage on that. And also, are we doing any communications around best practice, as in, you know, like we come in here when you stand up, wear your mark gloves, clean hands. What are we doing around best practice?
I'll just answer the second one first, and then I'll hand over to Nikki to answer around the vaccination supply in Luton. I think we could probably do a refresh of those messages as well, actually. They have been going out as we've been opening up, trying to make sure that it's clear that the virus hasn't gone away, it's still here, you know, remain cautious, keep thinking of others and be careful, and hands, face, space is still important. But I think we could probably reboost that a bit in the coming weeks. Yeah.
And in answer to your question, yes, there is AstraZeneca. I've seen the supply list. It was last week, Boots, Luton, Arndale missed, and it was a national issue. It was just missed on it. So all the other pharmacies have, but Boots have now. I think it was either today or tomorrow it's coming.
Oh, okay. Can you hear me, Amanda? Sorry, I didn't have my mic on. I apologise.
Oh, now I can. Thank you.
You're muted.
I have unmuted myself. Can you hear me now? Just checking if everybody can hear me.
I can hear you, Amanda.
Okay, so Councillor Hazel, can you hear me? Everybody on the team.
Amanda, can you hear me?
Yes.
Yeah. You're on mute. You can't.
Councillor Simmons, can you hear me? No.
If you want, do you want me to speak to it?
Yes, I think we'll have. Amanda.
Shall I speak to it, Amanda?
Nina will take it. Yeah, thank you.
Okay. Thank you. We've enclosed in the papers the minutes of the last Children's Trust Board, so that you can that's been going on, and in fact it was a fantastic, huge amount of really good evidence-based reporting on work that's been going on, and also stretch ourselves further on the child-friendly town, and a recap on the plan for that, and also seeking from members of the Children's Trust Board representing different organisations their own commitment to their contribution to a child-friendly town. So there is an intent that each member comes back with their pledge, and that will be followed up. We then had work on the Universal Plus for the children. We had the population health, wellbeing strategy, which we're going to see a bit later, and reports on the healthy and active food programme that took place during the summer, to help children to catch up with some of their emotional development as well as their educational development. And we also took a look at the employment and skills strategy. So I won't go into any more detail. You'll see the content in there. And if you have any questions, then either I will try to answer them, or Amanda will put a more detailed response in the chat if it's something I can answer. So I'd welcome any comments. Thank you.
Thank you, Nina. Okay, questions from anybody?
Councillor Hazel,
No.
I'm just doing a test.
Amanda? Trying
Can
to
you
say
hear me
something.
now? I think I've been
Can't hear
released.
you. Can't hear you. Sorry. Yes, Javid.
Thank you. I think that report's very comprehensive, very good. What are we doing also around children with learning disabilities? Is there anything special that we're doing for them?
So the progress on improving our offer has been significant, and there has been a revisit, and we're expecting more work to go on with that. So we're on schedule. I think, if I remember correctly, we are expecting another visit. It could be at any point from the and I'm trying to remember, it's not CQC, it's Ofsted. Yes, we're expecting a visit at any point, and we will get notification on a Friday that they're going to start on a Monday, and we haven't had that yet, but it could be at any point. But the team feel they're well placed. We've made significant progress, and obviously there's ongoing work, reporting all the time.
Any questions from any other members? No? Happy to agree with the report? Thank you very much. Sorry about this, Amanda. Sorry. And we move on to the Luton 2040 annual conference. Is that yourself, Sinead?
Hi everyone. Hopefully you've had a chance to read the report. For those who don't know me, I'm Sinead McNamara, Head of Policy, Strategy and Partnerships for Luton 2040. So I'm just going to briefly talk about the Luton 2040 conference, which is scheduled for Tuesday, the 30th of November. I'm hoping that you have now received your formal invitation to the event and how to sign up. The theme of the day is levelling up, but it's a real opportunity for us to look back over the last 12 months. And then as we look forward on how we continue to work together to level up Luton, we've had already had some great keynote speakers confirmed, including Sir Michael Mormott, who's going to work with us around Luton becoming a Mormott town. We've also got the Resolution Foundation, and we are hoping that one of the levelling up ministers will join us in the afternoon, and if not, a civil servant. I've got a conversation with them tomorrow, so fingers crossed. The afternoon session is focused on town centre and climate change, and there will be a number of panel sessions throughout the day. So we'll have a number of key experts joining those panels to sort of take part in Q&As and present to us as well. We will have a young persons panel late in the morning, which will be dedicated to just young people, and they're going to present to us on the work they're doing on 2040, but what 2040 means to them. And young people will also sit on each of the other panels as well. So it's really a chance for us just to really reflect and then look forward. So today's session is about encouraging you to sign up, and if there's anyone else that you think should be there, please forward on the invitation or come back to me and say, we'd like this person invited, can you make sure they're there? So it's not just local people, there'll be regional and national people there. So it's a real opportunity for us to raise Luton's profile on the great work we're doing. But we know we've got challenges we still need to work on. So again, it's about having the right people in the room to work through those. So hopefully you're all going to be there. Has anyone got any questions about it?
Any questions from anybody? Have you all received a notification? Yep. Yes. So you've all signed up? Not quite. Okay, Javid.
Thank you, Chair. I guess in that, one of the important things for me is being about aging well. Is that covered in there? Because if that needs to be very much a focus, I think as people are living longer, we want them to live healthier and, you know, enjoy a better lifestyle in their golden years.
How we work together to improve that. Sorry, did you want to add something?
No, it's just putting on your mic, wasn't it?
Oh, sorry. So yes, we'll make sure that's fully covered within that presentation. So there's about 5 or 6 panel members who are really broad across that spectrum, including Sir Michael Mormer, and then his deputy Jessica's also joining us on the day.
Chair, just to note that at the end of last week, we also wrote to Marcus Rashford, given his work and prominence in this area, to invite him to speak as well.
Respond to Sinead as requested. Yeah, thank you.
Thanks, Hazel.
Move on to item 9, Joint Strategic Needs Assessment. Is that you, Sally?
Yes, thank you. So this is an update paper on our progress with the Joint Strategic Needs Assessment, which, just as a reminder, is a statutory requirement as part of the Health and Social Care Act 2012. So all local authorities and CCGs should have a statutory responsibility to have a joint strategic needs assessment, which sets out the health and care needs of the population that they serve. And it's sort of owned by the Health and Wellbeing Board as part of that. So our JSNA hasn't been updated for some time now, and is due a refresh. When I presented a paper updating on the health and wellbeing, population wellbeing strategy a few meetings ago, I proposed that we would be bringing something back on the JSNA, reinstating the JSNA steering group and moving this forward. We have been recruiting public health analytical capacity and had a bit of a struggle with getting the support that we need to fulfil the statutory requirements. So we're a little bit behind on the schedule compared to where we were hoping to be. But we now have some team that are working on this and planning to pick up pace for the rest of the financial year. So the paper just talks through where we are with the proposal in terms of moving this forward, making it streamlined suite of products that host information about Luton. So not a huge document that lays out all the data, but something that's much more interactive and online that can be accessed and updated in parts, not a full huge document that has to be updated and takes years to update. So there's a need to make it more modern and refresh it. So the format of the new JSNA will be high-level, shorter reports with two key main documents. One that's a sort of "This is Luton" document that describes Luton as a place, including key demographic and socioeconomic indicators. And then another key document that will be around the health and social care needs in Luton, demands on services. And underneath each of those will be smaller geographical areas, so ward profiles, smaller area health profiles, a JSNA dashboard, and then also deep dives on certain topics. So we'll only be able to complete a handful of those per year, and we'll set up a process for rationalising and deciding what we'll focus on each year. So we're already underway with a sexual health needs assessment. So that will be one focus area for this year. There's a domestic abuse needs assessment that's currently underway, and an alcohol needs assessment that we're currently completing as well. So there's already some in train on the deeper dives, and they will sit underneath the broader documents that form the core of the JSNA. It also linked to the population health management work at the ICS, and we're developing a Luton approach to PHM as well. So a Luton-based group that sets priorities for this approach in Luton specifically. And this approach is around using population health data to stratify, segment the population based on risk, and then target interventions for specific groups. So there's a lot of work happening about this at ICS level, but also looking at place and at PCN level as well. So that will link into the JSNA. And then we are in early conversations about an approach to having a public health observatory. So thinking about how we streamline and have some economies of scale around how we're working around some of this data analysis within the ICS. So thinking about where have we got shared needs for data across the whole patch, and where would it make sense to do things in a similar way with a similar format and using similar data and share, so that there's not sort of 4 different teams doing the same thing. One person could do it 4 times more easily and share that learning and share that information across. So it's an easier way of working across the whole footprint, but still maintaining that place-based focus as well, and having the JSNA, the pharmaceutical needs assessment, and the population health management approach just for Luton. So that's an early thinking, and I propose to bring something back around that as it gets worked up a bit further, of what that would look like to the next meeting. So I've asked for that to be on the agenda at the next meeting.
Are there any questions from anybody? Yes, Nina.
More of a comment, or a couple of comments actually. So I welcome the initiative around a public health observatory, because this is very labour intensive, pulling together the data. So if it's possible to automate and then slice and dice it according to geographical areas and place and local authority, etc. I think that's really, really helpful. And as you say, at least when we're comparing and trying to learn from each other, we're actually comparing apples and apples. We know exactly what we're comparing and what interventions have been done. So I think that's really helpful. And recognising again the need to do sort of specific areas of deep dive. It makes sense. We can't, much as we might like to do everything, we can't. So specific areas, and I think the ones you've highlighted are really good. Yes, I welcome the report and look forward to the next one around the Public Health Observatory.
That's great. Thank you. Helpful.
Thank you. Anybody else? Nobody else? Oh, Javid, sorry, I didn't see.
Thank you. No, so I welcome the report. I think it's a great idea to change the format to make it less. We've got to do it, and I think Nina's absolutely spot on. I was going to say a standardised ICS plan is with the observatory is definitely the way forward. I would welcome that. I think that would help us, because then we'd have a standard approach across the BLMK. So I think the report is very good. Thank you.
Thank you. And just to highlight on that it would be where that's appropriate and helpful to do. So if we had local based specific data analysis that we needed, it wouldn't be all ICS kind of pooled resource, that we would still have that local resource is the idea behind it, but needs to be worked up further. Thank you.
Population wellbeing strategy.
Me again. Thank you. So I will just talk through, just finding it in my pack, where we are with the strategy. So this came back, hopefully you will remember it coming here this time last year probably. And I think it's fair to say things have moved on a fair bit since then, and thought it was important to bring it back now, engage you all on it, make sure that people are still aware of the content of the strategy, make sure that the strategy itself is still relevant, and that it's flexed and adapted to meet the needs of where we are now in light of the impact of COVID, changes within the system coming together as an ICS, changing from being Luton CCG to BLMK. So in all of that context, making sure that the strategy is still current and that there is ownership from this board of the strategy, because obviously it's a statutory requirement to have a population health and wellbeing strategy, that's owned by this board and holds the strategic direction for health and wellbeing at place through this strategy in this board. So it is a live strategy. It's still, a work in progress that we're constantly looking at and refreshing and making sure is working for us. So I won't talk through slide by slide because you've all seen it, you've got it in your packs and you can have a look at it. But it would be helpful just to draw your attention to some key elements of it. It's not you can't see the numbers in your slide in the slides, can you? So there's a slide that lays out, hold on. There's a starting well and developing well priorities. So there's a slide that has, it's 65, sorry, page 65. So that lays out, so the strategy is laid out in the life course. So we've got starting well, living well and aging well as the three key life course areas. So actually, in relation to your question before, Councillor saying that the ageing well is a key theme of the strategy. So there are some key actions within there that meet that age group. So we've laid it out by starting well, living well and ageing well. And within each of those areas, we have set out some key priorities that we want to be delivering against in those areas. We also have a key strategic lead from the public health team that can help drive those forward, working with partners across both the organisation and the system. On page 71, it lays those out in table format. So across those three life course areas, you can see the key actions the key priorities that we want to be taking forward. And they will be delivered mainly through the Children's Trust Board that Nina reported on, the Health Inequalities and Prevention Board, and a lot of the ageing well priorities will start to come out through the Emerging Place Board that we will be updating on again in the next meeting. So they will all be sitting as key priority areas within each of those place-based partnership boards to drive forward against those priorities. Laid out in the strategy as well, there is a more detailed action plan for each of those priority areas, which I won't go into detail, but there's actions against all of those that are either in starting to be worked on or being developed now. So they are all there in detail. And then there's also KPIs, performance indicators for each of those key areas as well that are not final yet, but are being worked on very hard in the background to make sure that they reflect the actions that we're taking forward. One of the key elements of this work that Sinead mentioned as well is around Sir Michael Marmot coming and talking at the Luton 2040 conference. So we are looking at developing Luton to be a Marmot town, working with Sir Michael Marmot and his team from the University of College London. And we've actually got the kick-off meeting for that work tomorrow. And I think it's going to be really important as part of this strategy to help drive it forward and help to think, this is a lot in here and it's all work that's happening, but how do we make sure that we are taking it forward collectively and it doesn't get lost, because there's so much in here. So I think that work will help us focus on distilling down to what are the key things over the next year that we really can achieve. And I'll, as we go, be engaging people on that journey and talking to people about how we work through that process. So I think that will be key. And I, again, think it would be good probably to bring back an update on that specific way of working to the next meeting. So open to any questions.
Thank you, Sally. That's really interesting. Any questions? Oh, yes, Nina.
I think this is all progressing really, really well, and you know, that drive to the 2040 vision is coming through in everything. So, you know, great. How do we? How have you engaged so far, and what help do you need in terms of getting that wider engagement in primary care and primary care networks? Because the principles about addressing health inequalities, everybody gets excited about. That's what they're there for. That's what they're wanting to address. But finding the right amount of time and the right people to contribute to this and drive it through everything else as well in primary care would be really helpful, both for the town and actually for primary care surviving and meeting demands appropriately. So I was just wondering, where else is this going to go to in terms of engaging with the right people and getting those enthusiasts as part of the drivers for you?
Yeah, I think it's a good question. Nikki's just offered to start answering, and I can come in if needs be after.
Yeah, only that Carolyn, Sally and myself have had those very discussions over the last 2 or 3 weeks, so it's an iterative process. So we are really aware we've got an OD need, and we've got participants in various meetings of levels of expertise, and so it's very much a bespoke arrangement that we're going to be doing. Funnily enough, we've actually got a place board tomorrow, because it's important that the primary care networks are about groups of patients. Although they're registered list of patients, they come from, you know, households in little communities. So I think, in fairness, I've certainly learned quite a bit in the last couple of weeks with Carolyn's experience from Nottingham. So you may want to carry it through. So that's absolutely key, Nina, about taking this learning through.
Thank you. I think I welcome this population strategy. I think it's very comprehensive. The only concern is how we've got the capacity to deliver this, because obviously that's, you know, resource is a significant worry, but otherwise strategy is perfect. It's very comprehensive. And I think the key thing is we need our health partners involved wherever possible.
Yeah, thank you. Sorry, Robin looks poised to respond, sorry. So I'll just say something quickly and then hand over to Robin. Yes, thank you. I agree that there is a lot in there, and it's not just one person's job. So it's a system-wide strategy that relies on all partners to do their bit within it.
I think Sally's just said it. I think Councillor saying, fantastic question, absolutely the right question. It's about us working collectively together across the whole system to ensure that the resource that we've got across the whole system, which is considerable, is directed in the right way and focused on the key strategic aims, which is why members of Health and Wellbeing Board will recall, which is why I was so excited a few months back when the CCG announced their new strategy, which absolutely aligns with our 2040 vision.
So I was just looking at these key performance indicators, of which there are numerous. And it shows kind of the trend, which is improving, flatlining or worsening, but are there targets associated with any of those KPIs?
Thank you. Good question. So the KPIs do need a bit more work, and we're trying to streamline them a bit so there are fewer, and also set targets against them. So there is some more work to do on those, and it links back to that analytical capacity point I was making, the JSNA work, that we haven't had the person to really help me focus on these, but they are now in post. So I will be doing some work with them over the next couple of months and get that a bit clearer.
Nikki?
Yeah, can I equally just draw everyone's attention to the guiding principles, because I think that's a real nugget in this document, and it very much is listening and responding to our communities. So just by parallel today, we've had a discussion in Luton with regards to how we target the population to really access COVID vaccinations and flu for that matter. So for me, I really do welcome, and I think what would be helpful is to have the standalone document of this, that we could all as members take responsibility for our sphere of influence to share this, because I think it's a very easy to read document. And I know that this work that I'm now embracing on, it's about working with the 5 primary care networks in those local communities. So if we almost could start, dovetailing into different community groups, I think that would be a really good action for us all, and perhaps to report back of who we've influenced, because that's the only way we're going to make this real. Because I think somebody said everyone's so busy, you often don't get the opportunity to read this. So I'm very happy to take that with Nina's support to our primary care networks, and the community pharmacists I think will be really interested in this.
Yeah, that would be great. I'm happy to share the slide set that goes with it, but actually it just triggered me to think that it would probably be useful to have an even a shorter version, so to take out the really key salient points from it, so it's not I don't know how many slides it is, but it's not quite so big, to make it a bit more digestible for people.
Idea. Very good idea, Sally. Yeah. Okay. Any other questions from anybody? Yes, Simone. Sinead. Sorry.
Just picking up that last point, I wonder when we move forward with the Luton 2040 pledge, if that's something we could pick up there around them signing up to deliver against, because we haven't done much work through the Health and Wellbeing Board on that. We've done some through the Inclusive Economy Board, but I think we could pick some of that up.
Yeah, that would be great.
Thank you. I agree with all of these comments. When I was reading this refresh version, one of the things that struck me was actually there has been some progress forward, that Luton is not now as deprived as it was. And whilst we all know we've got a huge way to go, I think making that clear that there has been some progress engages people some more, because they can see that, look, it's a big task, but actually we're starting to erode the problem, and therefore they will get behind something that's possible, whereas previously they perhaps thought it wasn't possible and were dejected. So let's make sure that's very clear.
Anybody else? Yes, Phil.
I think that's important. That's why I go back to the KPIs. If you've got easily understood few KPIs which you can then promote to show progress, that remotivates people to get people driving on. Otherwise, they just think they're wasting the time.
I think the journey's too long, too big. Yeah. Robin.
Thank you, Chair. Just to give members of Health and Wellbeing Board my favourite current statistic. When we set off on the journey, the poverty rate for children in our town was 46%. By March of 2020, so the month of the start of the pandemic, that figure had been reduced to 39%. Now, 7% might not sound like a big figure, but let me just put that into context. That is over 4,000 children who were no longer growing up in poverty over that timescale. That is a huge, huge impact on our town. Now, obviously, the pandemic has hit Luton hard. And unfortunately, as we're coming out of the pandemic now, very much the message needs to be to dust ourselves off, pick ourselves up and drive again. But our vision to eradicate poverty in Luton was happening and will happen. Thanks, Chair.
One comment. I think it's very important that we recognise, as Linda says, that you only one of the key ways to alleviate poverty is through education and skills, and education, whether it's in health, education in how you live, age, and I think education has got a lot to play with it. So I think we should be proud of the fact that we've done well, and and education is what I said earlier on about best practice. It's all about educating people to take responsibility for their actions.
No other questions from anybody? Okay, are we happy to approve the recommendations?
Yes.
Thank you. Hello, David. Welcome. We now move on to the Luton and Dunstable Hospital redevelopment, and you're on.
What would you like to say? If you just sit there, David, but if you put your mic on, the camera will come to you. Okay.
Have you got all the paperwork's in the report, is it? You're not, are you putting a?
Yeah, there is a presentation which my colleague knows how to actually drive for. David, if you just say when you need the next slide and so on.
Thank you. There we go.
Okay.
So thank you very much. Thank you for having me here tonight. First of all, apologies from David Carter that he was unable to attend. He's tied up in Bedford at the moment. So obviously the hospital is under a lot of pressure at the moment. So I'm the redevelopment programme director for Bedfordshire Hospitals NHS Foundation Trust. And I'm very pleased to come here and give you an update as to where we are, because we've done something since I last spoke to you about 5 years ago. So I'm going to give you a bit of background to the project, why we're doing this, some details of the scheme. I want to show you what else we're doing at the L&D apart from the main redevelopment, and then I'm happy to answer any questions at the end. So if we can have the next one. Okay, so the L&D's been here for a long time. It was in Luton town centre until 1938 when it moved to the current site. It was in the middle of fields when it was built, and it has grown substantially since then. I'm sure you're aware of the health parameters for this area. We're one of the fastest growing areas in the UK. And we're continuing to grow, and the hospital service has to grow with it. The current hospital was opened in 1938. It had 2 wings, and when they opened it, they said they provided 2 theatres because they never ever wanted to run out of theatre capacity ever again. When we finish the redevelopment, we'll have 21. And so that will give you an indication of where we're going. We've got about 800 beds and 4,500 staff at the L&D, but we're also merged with Bedford Hospital. So we're doing a lot of sharing of activity and work with Bedford. We provide a level of tertiary services to a wider population. And we've got a pretty good record. When the 4-hour target was in play, we were top of the league for many years. When I left this evening, there are about 15 ambulances outside the A&E. it's really astonishing the load that goes on the ED at the moment. So we're a great performing trust, but we've got some really rubbish estate, and we want to do something about this. So next slide, please. So what do we want to do? Well, the first thing we wanted to do was to build a new hospital, but that wasn't viable. We looked at a number of sites in and around Luton about 8 years ago, and then the conclusion was that we needed to redevelop the current site, and we needed to really focus on some key issues from the site. So the first thing we wanted to do was to do something about our theatre capacity, make it more efficient. So we've elected to build some new theatres alongside the existing theatres on top of the surgical block. That allows us to co-locate a lot of services, allows us to be more efficient in the way that we deliver that service. We want to provide more capacity across the site, particularly in maternity and the neonatal intensive care, where life is very constrained by the old facilities that those services operate from. We want to be more sustainable in terms of what we do. We are a complete outlier in terms of the amount of energy that we burn, and we want to do something about that, and we want to do it well. We want to improve the quality of what we do, and we want to work with our partners in the ICS. And so we want to support what they're trying to achieve and where they're trying to go. So if we have the next slide. And these are some of the challenges that we faced. While we started on a greenfield site, residential development has hemmed us in, and we can't expand sideways. So we have to expand by knocking something down and building something new. I think it's safe to say that there's been some ad hoc development on the site over a number of years or decades. As soon as people had money, they spent it and didn't really think carefully about where they needed to spend it. So we've got a lot of adjacency issues. We've got very old buildings. We've got a backlog maintenance figure of about £90 million. That's about 3 times what you would expect on acute hospital sites. And of course, because we have this poor estate, it presents problems to the way we deliver services. And against this background, we're getting a more elderly population, and acute services are getting much more complex and technologically advanced, and patient expectations are growing. So people want to see a better level of service from the site. Can I have the next one? And there's a clinical case for change. We have to maintain separation between male and female and old and young. It becomes increasingly difficult to do that within the constraints of what we have at the moment. We want to focus this phase on the care at the right time in the right place. That's terribly important. And it becomes more and more challenging to do that in an environment which is very poor. We have to address the fact that healthcare staff are very limited in numbers, and we need to be able to attract and keep people that we need to run the services, and we need to give them a reason to stay with us. So, if we're providing good facilities, then that builds good teams and therefore makes the place a more attractive place to work. And we need to be flexible, and flexibility is a big word that people use. But as life changes, and we've seen life changing very dramatically over the last few years, and we need to go on being flexible in terms of the way healthcare develops and the needs of the population develop. Next one. So this is what we're going to do. Now, this is the core building on the site. It sits where the old trust offices used to be. I can say that confidently now. This is the same building as we brought to the council 6 years ago when we did the first planning consent. It's really not changed at all. It comprises a maternity unit on the ground floor. There's a critical care unit on the first floor. Now, it's on the first floor because it needs to link through to the main site, and that's 2,500 square meters of critical care services. Above that's the neonatal intensive care unit. This is an important tertiary service. And then, as I said at the beginning, on the top floor there's 8 new theatres. 2 of those theatres are what we call hybrid theatres. So they're very big theatres that can be used for new services in the future when we start to bring in robotics and interventional services. That's what these theatres are designed to provide for. And it's all supported by an arrivals area. When you come into the new building, you will be put into a pod. So you will get undressed in your pod. You will then be taken to the theatres. You'll go through recovery, and then you'll come back to your pod to recover and then go home from that pod. So it's a transitional service, but it's a pod system, which is it's a better level of environment for patients. So they're familiar, they've got the stuff there, and then they transition through the theatres and back out again. It also allows us to maintain separation between patients. So we can use pods for paediatrics, or we can use them for elderly care. Okay, next one. Now, when we went through the outline business case, we tested whether, in fact, it was a better solution for us to build a ward block alongside the maternity block. And we ran a number of scenarios. So this is the difference between the current scheme and the scheme that we had 5 years ago. So this is a ward block. It's got the pre and postnatal wards, which are linked to the maternity service. And what that allows us to do is to really co-locate all of the maternity services in one area. They all have a single arrivals point. So round the back away from the service road, there's a separate maternity entrance. All the supporting maternity services are there. So we're keeping everything in the same place. What the new ward block also does is it allows us to use the old maternity block as a decant facility for future years. So as when we've completed this and we moved the maternity wards across, we can use the maternity ward block to allow us to refurbish all the old wards in the building and to support those as we go about the continuing redevelopment. Next one. And this is a sort of aerial view of the site when it's finished. So you can see the main building in the middle, which is the services block. To the right-hand side is the ward block, so that sits behind the surgical block. And on the left-hand side, you can see the new energy centre, and we'll get to the energy centre in a minute. So we're completing the FBC. It's what we know as a Boris 20 scheme. So it's in August 19, the Prime Minister identified 20 schemes that he wanted to accelerate. So we're one of those. I think there's only 2 of us left. A 2.5-year construction programme from January next year. And we're all good to go as long as we can get the money from central government. Next one. To get the money, we need to have the full business case for the scheme approved. So we've submitted this at the end of September, and we need to get this through the system by January. Throughout this process, we've been really heavily engaged with the NHS Improvement and NHS England. We've been engaged with the department, all designed to get us to a point where when this document goes to Treasury, which it will do at the end of November, they can tick it and then give us the money to get the scheme going. In parallel with this, in May of this year, we ran a procurement exercise and we appointed Kier Construction as our construction partner. So they're delivering the construction design, and then if all goes well, when we get the approval, they will then go on to build the scheme. Next one. I think the council knows quite a bit about Kier because they have been engaged with them on the rail link, the airport link. And it's been very important to us that we work with local groups and local bodies to maximise, spending as much money locally as we can. So we're trying to use the investment to kickstart a number of local businesses. We'll get to climate change in a minute, but we're trying to use it as a training opportunity for people as we go through the scheme. It's difficult on a short-term programs. It's 2.5 years to actually get somebody through an apprenticeship, but you can use the scheme as part of a broader approach to training, and that's what we're planning to do. So these are some of the things that we've linked with already. These are from Kier, but we have actually in the background been actively engaged with local bodies. Next one. And in order to build the scheme, we've had to build some decant buildings. So the picture on the left is the new office block, which went up at the end of last year and was occupied at the beginning of this year. The picture on the right is the temporary building for audiology. So there are a number of spaces where we've literally had to clear a third of the site and move people off. And then when the buildings are complete, we'll be able to move them back again. So there's a lot of investment has gone into the enabling works. All of that's been funded by the trust. Next one. And we've done something about parking. It's been long an issue at the L&D, and it was the main picture is the new visitor car park on Lucy Road. It has made a huge difference to the way traffic flows along Lucy Road. It's really an important step forward. When the original scheme in 2015 had a car park being built at the end of the scheme, and what we've done here is we turned that round and we've done the car parking at the beginning, and that's a massive step forward. People love the car park because it's easy to use. It's easy to park in the car park, and although we have a reduction in visitor numbers, it is taking a lot of that traffic off the main roads. And the picture on the right is one of our temporary staff car parks. So we cleared a couple of sites on Dunstable Road to create parking. So we took 250 staff cars off the residential roads. And that's been also a big step forward for us. So over the past few years, I think we've made a very big step change in the way that parking is an issue on the L&D side. That's not to say it won't be again in the future, but in parallel with this, we're really investing in trying to encourage people to use more sustainable means of transport. So there's a big cycle hub in the car park, which is a really super facility. and we're trying to get more people to use public transport and cycle and walk as well. Next one. And this is where the Trust HQ used to be. It is now a huge pile of rubble. And this rubble will be crushed on site and then used as fill underneath the new building. So we've found a way of restricting the number of lorry movements to actually get this material off site. There's about 2,000 cubic meters of broken brick there, and it's all going to go under the new buildings. So from an environment point of view, it really is a good use of the old building. You can see in the top right, that's when we lifted out the old link bridge. It proved to be somewhat more fragile than we thought, so we just cut it up. But all of that steel's been recycled, all of the timber's been recycled, the plastic's been recycled. So it's a huge reuse of material. And the whole site will be cleared by Christmas. So we're ready to start work. So that's been an important. There are quite a few nice little videos on YouTube if you want to watch demolition in action. But it was really interesting to watch them how they did it. Next one. And this is the energy centre. So the energy centre has come along really significantly. Putting the flue up was a major change that people saw, but the steel frame went up at the beginning of the year. I think we skipped the energy centre. The building cladding is going on now, so you're beginning to get a real sense of what this building is going to look like. The big items of plant will be delivered in November, so the new generators, which give us the resilience to run independently of the grid, which is a huge step forward for us. They'll be delivered in November. The new CH combined heat and power plant and the new boilers, again, they all come in November, and we start to wire everything up to deliver the new building. It takes a third of our carbon emissions away. It's a really big step forward. You know, the NHS is aiming to be net zero carbon by 2040. We're going to be planning that journey for this site. So the energy centre is a key step forward. We take away over 70 gas boilers that we've got on the site, and we run 4 boilers and a new primary heating circuit all the way around the site. And we've got the combined heat and power plant, so we're using energy to generate electrical energy, and using the waste heat to heat the water. So it becomes much more efficient in terms of the way we operate. So this is on schedule for completion in 2023, to allow us to support the commissioning of the new buildings. Next one. And if we didn't have enough to do at the L&D, at the end of last year, we got given funding to support an expansion of the emergency department. This is a really challenging scheme for us because we can't impact at all on the operation of the emergency department. So what we're having to do is to build a bit, move a bit, build a bit, move a bit, in a building that was built in 1960. So there's some very old services in there, which have taken some tracing, but we're on the way now. The first phase will be completed at Christmas. We've got a new CT scanner going in here, but more importantly, we've got additional waiting room capacity. So the current situation where we've got people queuing out for ED outside will go. Also has dedicated mental health facilities, and it really is just a just-in-time step for the ED to support the pressure it's under at the moment. So we'll complete this at the end of next year because we have to do this in phases. But the first thing you'll see in November is the steel frame going up, which will then close in the gap at the front of the building and allow us to put the new plant that we need, the new ventilation plant that we need to support the ED in place. Next one. And we're working with the council. We're working very positively with the council in terms of what we're doing. We entered into a planning performance agreement with the council when we went through 2020. We dealt with 34 planning applications. It was a stunning success. It really was amazing, the support that we had in terms of progressing these applications. And I just can't say enough with the planning team. They were brilliant, absolutely brilliant. Never known anything like it in my life, and absolutely fantastic. So it allowed us to put the whole scheme on a really positive footing going forward. And on the back of that, we're working with the building control team. So we went to Karen's team and said, look, we're going to appoint you for doing everything, and then we'll just have a schedule of engagement as we go through each building. And that's really working well because we've now got a properly resourced building control team and a real understanding of the site as it develops and emerges going forward. So really top class, really, I can't say enough in favour of this. And then we had the leader to come and open our new car park, which was brilliant. So it was a nice day. One of the few last nice days in the summer. But that was really appreciated. And I think recognised the significance of what we've done in that car park. And I think that's the end of it. Next one. Yes. Thank you very much. Thank you for listening.
Thank you very much. A very full presentation on what work you're going to be doing. And I know my residents are very grateful for the parking arrangements that have gone in at the L&D down Lucy Road, which was, as you know, a big issue for them down there. So it's open for questions now. Nina?
Thanks, David, and it's interesting to see the progress there. I don't know how much has gone through the CCG board. Certainly, me as a GP, I haven't heard this progress, so there might be something about the communication that could be better, so that practices know what's being what's happening now and what's moving coming later. I'd like to focus a bit though on understanding a bit more about the added social value. So you've got the key social values there, and you've got some highlights of some of the things that will be encompassed within that. So you know, the 50 new whole-time equivalent jobs. Is there going to be some focus about trying to ensure these are local people who are appointed into these jobs? How will that work?
Yes, there's a defined approach to how contractors do this. It's very much focused on making sure that the pounds are spent locally as far as you can. You can't spend every pound locally, but a key KPI is how much of the construction cost is actually spent within the local community. So there is very much a proactive approach taken towards trying to bring in local people. We're doing it at the moment. What we're trying to do within the redevelopment team is bring in local people to support the enabling works, to give them the experience that they need, to be able to say they've worked on a site and they've had experience. And we've been through the first cycle of this, and now we're going through the second cycle. So it is very much focused on using local people. We all keep track of where people come from. So when they're traveling to the site, we want to know where they've come from, how far they've traveled. And it really is, it's a mindset in terms of how you approach this and how you deliver the training that comes with this. And as I said, you need to build on training through a number of different projects. And in order for that training to be effective, you need a facilitator, and that's the council. So the council is facilitating this exchange of opportunities so that people are going through a training program and they're getting experience with us for as long as we can give them experience, but then they're moving on to other projects as they go forward. And there's a lot of effort being put into this, and we're working with the council on that.
For me, it'd be good to hear more about that, because obviously it's integral to about improving the life chances of our residents. And I think, I mean, your next bullet point was 30 hours of volunteering to local community. Is that per whole-time equivalent job, or that's surely so on your slide there, you've got COVID recovery, 15 new whole-time equivalent jobs, and then you've got 30 hours volunteering to local community projects. So is that per whole-time equivalent? Yeah, okay. Because I think, you know, knowing what that is, and then how does your voluntary community know who to contact to say we could do with some extra person hours, please?
Yeah.
You know, kind of that's a whole piece of work that actually, I mean, maybe there is a plan behind it, but it'd be good to know what that is and how we communicate that so that it does get utilised really effectively, because there's a real snowball effect here of this if actually we get it right.
That's correct.
Because on paper it looks like you think, well, what's that mean? 30 hours.
Yeah.
What impact's that going to make? But actually we could make it really effective.
So those organisations that I included on the slide have been actively involved in this process for not just with us, but with other projects across the area. And CARE have a nominated person who drives this process and who keeps track of just how good we've been at delivering this opportunity and this development to people from the local area. And you're right, it snowballs, and it's making sure that people are aware of those opportunities and to give them the chance to be able to get into the system and run through the system. So it's not something we've invented, it's something that exists, and it's something that we're supporting as we go through the development.
Robin.
Thanks, Chair. A comment really rather than a question. New build construction's really difficult to get right. Redevelopment is harder to get right. And the hardest of all is the redevelopment of a operational hospital site. So I suppose, Chair, my comment would just be, you know, I take my hat off to David and his team for the very positive progress that you've made to date. And I wish you the best over the next coming few months and years, because it will be a difficult project.
Thank you, Robin. Thanks.
Anybody else? Yes, Kachita.
Thank you, Hazel. I'd echo what Robin said there in terms of having something operational and then trying to develop that. I think, and I'd also welcome the fact that about the parking. That's something that we've had residents for years and years, and having a facility with more people and for the community of Luton and all that. It looks really exciting. I look forward to the fully developed site if I'm still around. Thank you.
Thank you. So, as somebody who was recently appointed as a governor on the hospital, I've seen some recently appointed. I think some of the work is very exciting, so I'm looking forward to that. So I guess the question, one of the things is the helipad. I know that's been delayed. What are the plans for the helipad? Because obviously that's an important, is really key going forward. Also, I'm interested in the additional mental health facilities that you mentioned in that stream, and also the 320,000 residents we serve. it's over 50%, because I think there's 600,000 residents all Bedfordshire. I think it's good for people to know that it's almost half of Bedfordshire, the Luton L&D, and it does a fabulous, job, without doubt. Also, maybe we could add some electric bikes, because the busways is a fair bit of walk, and Legal Station. Maybe there's an opportunity to look at some electric bikes so that people could lease between the sites, because now you've got quite a few sites.
I was in London a few weeks ago, and I was astonished at the growth of electric bikes. And I regularly cycle on the busway, and I regularly get overtaken by scooters. So I can see it coming, and we need to be ahead of that curve rather than behind it. So I absolutely agree with you on the e-bikes. The mental health facilities, at the moment, there are no designated facilities within the ED for dealing with mental health patients. Within the new scheme, there are, and they're properly spec'd and they're properly equipped. So that's a big step forward for us in terms of how we deal with people coming into the ED. On the helipad, we still have the plans to build the helipad. The problem is, at the moment, as Robin has said, it's extremely difficult to find any space to do anything at the moment, because we've had to shove everybody out the way. We've taken out all of the spare space that we might have used to support that project. What the ED scheme does, that building on the front, the top half of that is new electrical systems. And those electrical systems replace the systems that are underneath the helipad. So although it's not a direct link, it makes building the helipad that much easier when we get through delivering the ED and the main scheme. So the helipad is still there. It's still an aspiration for us going forward.
Just wanted to say, in terms of the point that Javid made around the scooters, would there be some way that there could be a trial around that by the hospital once it's, because I think the scooters are really, I know I've spoken to some of the students in other places where they're at the hospitals and they find them quite accessible in terms of not using a car to get to a hospital, which is linked to, like we have, I mean, it's not that far away, the busway in terms of Stanton Road, and trying to get to there, and how accessible is it for people to be able to use it? I know that we've previously been against the decision around having them around the town, but maybe a pilot around the hospital may be a good idea.
Run over most mornings by one that comes right there through. I thought I was big enough to see, but he often nearly just misses me. Javid?
Yeah, just to come back, I think I was talking more because scooters have a lot of nuisance, because if they're done properly with youngsters, I think e-bikes is where I've come from. I think we didn't reject that. I think e-bikes is the one, like in London model. I think that's the one we should look at our transport department to see if there's any sort of funding we could do jointly. But like you say, Mason, the e-scooters, like you say, you get overtaken. Unfortunately, they get abused by, because you can't stop who's hiring them. That's the only snag on them.
Anybody else? No? Well, thank you very much for coming along. Really helpful. And I'm sure you'll come along and update us when you're on to the next bit of it all. Yeah?
Well,
next couple of years? Yeah?
I won't. I'm about to retire.
Oh.
My deputy Melanie will certainly go along.
Okay. Brilliant. Well, in case we don't see you, you're not going soon, are you?
3 weeks time.
Oh, right. Okay. Well, maybe we wish you a very, very happy retirement. Yeah. And thanks very much. Everybody okay to note this report? Thank you.
Thank you.
We move on to the last item on the agenda, which is the work plan. I know you've got to say something, Bert, and are you moving this? Who's moving this, or is it just for note, really?
Chair, I was going to mention that there's a proposal to move the meeting on the 17th of November,
Mhm.
or cancel it and move it to a date in December. The 14th has been proposed. This is in line with trying to make these meetings every 2 months as opposed to every month. There had been one attempt at doing that already, but the meeting on the 17th of November is exactly just over a month after this current one. So we're trying to avoid this situation where there's.
So you want to move the 17th of November to the 14th of December?
That's correct, and move the items accordingly.
Yeah, yeah. Okay, that's fine. And then the next one will be the 4th of January. You're going to move that date as well.
And the 4th of January to cancel that one. And then obviously the following meeting will be in February. Which will be two months. Again, I think all the items are movable.
That's good.
Without any great impact on anything in timelines.
It does. It is sensible because of Christmas. Yeah, I think that's a good idea. Yeah. Be okay with that? Anything else on the agenda? Any questions anybody's got on the work plan? Otherwise, it will just we'll just note it. Okay. Okay. Can I thank everybody for their attendance? And for those of you that are here tonight, and for those of you remotely, but for those